Norovirus infection is an communicable disease. Look at this picture, shows that virus in the intestine and symptoms: stomach pain. Look at this detail going on. Introduction. Norovirus, often referred to as the binder vomiting bug, is a highly contagious virus that causes gastroenteritis, inflammation of the stomach and intestines. It is responsible for a significant number of foodborne illness globally and can affect people of all ages. Norovirus is prevalent in various settings, especially in places where people gather closely, such as hospitals, nursing homes, schools, and cruise ships. Definition. Norovirus infection is an illness caused by norovirus, a genus of RNA virus in the family of Calliciviridae. It leads to symptoms of gastroenteritis, primarily acute, vomiting and diarrhea, which can cause rapid dehydration and severe discomfort. Types. Although there are multiple genogroups of norovirus, the most common that affect humans are 1. Genogroup 1 GI1 contains virus typically associated with jellyfish related outbreaks. 2. Genogroup 2 G2, the most common group affecting humans and responsible for the majority of outbreaks. 3. Genogroup 4, rare but has been identified in some human cases. Causes. 1. Ingestion of contaminated food or water. Consumption of contaminated food, especially jellyfish like oysters, can lead to infection. 2. Person to person contact. Close contact with infected individuals is a common cause of transmission. 3. Contact with contaminated surfaces. Surfaces contaminated by the virus can transmit infection, particularly in shared environments. 4. Aerosolized particles. Vomiting can aerosolize the virus, leading to further contamination of surfaces and people. Transmission 1. Fecal oral route. Norovirus spread when virus particles are ingested from food, water, or surface contaminated by feces or vomit. 2. Direct contact with an infected individual can easily spread the virus. 3. Aerosolization. Vomiting can create aerosolized viral particles which may then be inhaled on surfaces. Risk factors 1. Living in crowded environment. Example, nursing homes, military box. To consuming contaminated food. Particularly raw, undercooked shellfish. 3. Frequenting hospitals or healthcare settings where outbreaks are common. 4. Having close contact with someone who is infected. Complications 1. Dehydration, rapid fluid loss due to vomiting and diarrhea can lead to dehydration, a serious concern for children and the elderly. To electrolyte imbalance, loss of salts and minerals can result in complications like confusion, muscle cramp, and heart rhythm issues. 3. Hospitalization. In severe cases, especially among high risk populations, hospitalization may be required. Pathophysiology. Norovirus binds to receptors on the epithelial cells of the small intestine, initiating cell damage and inflammation. The virus disturbs the gut's absorptive functions. Leading to malabsorption, increased secretion of fluids, and electrolyte imbalance, which manifest as diarrhea and vomiting. The virus also inhibits the motility of the intestines, contributing to nausea and bloating. The pathophysiology of norovirus infection involves A series of steps as the virus enters the body, attaches to intestinal cells and causes symptoms. Here is step by step breakdown. 1. Entry into the body. 2. Viral attachment and binding. 3. Inversion and replication. 4. Cellular damage. 5. Inflammation and immune response. 6. Increased intestinal secretion and motility. 7. Symptoms, manifestation. 8. Setting of virus. 9. Resolution and recovery. The step-by-step breakdown highlights how norovirus disrupts the intestinal tract, causing the characteristic symptoms of gastroenteritis, vomiting and diarrhea, through a cascade of cellular damage, inflammation and fluid imbalances. Symptoms. 1. Acute nausea and vomiting. 2. Watery diarrhea. 3. Abdominal cramps and pain. 4. Low grade fever, chills and body ache. 5. Headache and muscle pain. 6. Fatigue and malaise. 7. Symptoms typically appear 12 to 48 hours after exposure and last between 1 to 3 days. However, in vulnerable individuals, symptoms may persist longer. Diagnosis. 1. PCR testing, the most common and effective diagnostic test, which detects norovirus RNA in stool samples. 2. Rapid immunoassay, used in some cases but less sensitive compared to PCR. 3. Clinical evaluation. Diagnosis can also be made based on symptoms and epidemiological factors, especially during outbreaks. Nursing diagnosis. 1. Fluid volume deficit related to diarrhea and vomiting. 2. Imbalanced nutrition less than body requirements. 3. Risk for infection related to compromised immune status. 4. Acute pain related to abdominal cramping. 5. Risk for electrolyte imbalance related to fluid loss. Management. Medical management. 1. Rehydration therapy. Oral rehydration solutions ORS or intravenous fluid for severe dehydration. 2. Antiemetics to manage nausea and vomiting. 3. Electrolyte replacement necessary if significant loss occurs. In nursing management, 1. Monitoring vital signs. Regular monitoring for dehydration signs. To encouraging rest. Rest helps the immune system recovery. 3. Educating on hand hygiene, essential to reduce transmission. 4. Maintaining hydration, encouraging fluid intake and monitoring output. Treatment. Since there is no specific antiviral treatment for norovirus, management focus on supportive care and symptom relief. Here are 5 treatment options. 1. First option, oral rehydration therapy ORT. Purpose to prevent dehydration due to fluid loss from vomiting and diarrhea. 2. Intravenous fluid IV fluid therapy. Purpose to manage severe dehydration when ORT is insufficient or not tolerated. 3. Antiemetic medications. Purpose to control nausea and vomiting, making it easier for patients. 4. Antibiotics and analgesics. Purpose to reduce fever and alleviate muscle pain. Or general discomfort. 6. Probiotics. Purpose to support gut health and restore normal gut flora. These treatments are aimed at managing symptoms, supporting hydration, and preventing complications. Most people recover with supportive care within a few days, but high risk individuals may require closer medical supervision. Psychosocial medicine. 1. Emotional support. Patients may feel anxious or embarrassed due to symptoms, and reassurance is essential. 2. Family education. Elderly and immunocompromised patients may require additional emotional support and encouragement. Prevention. 1. Hand hygiene. Frequent washing with soap and water, especially after using the restroom or handling food. 2. Disinfection. Surfaces contaminated with vomit or stool should be cleaned with a bleach based disinfection. 3. Hand hygiene. Frequent washing with soap and water, especially after using the restroom or handling food. 3. Disinfection. Surface contaminated with vomit or stool should be cleaned with a bleach based disinfection. In conclusion, Norovirus infection is a common but serious cause of gastroenteritis worldwide. While self-limiting in healthy individuals, it can lead to severe complications in vulnerable populations. Prevention focus on hygiene practices and prompt management of symptoms. Education, especially in high-risk settings, play a vital role in minimizing outbreaks. Thank you. Have a nice day.